If you work in public health and it feels like many days, your heart is racing, you're stressed, you're anxious, your body feels tense, everything feels urgent, you feel like you could explode at any second, or you're shutting down, you're distancing yourself, you're becoming apathetic or numb, this video is for you. Today, I'm going to teach you simple tools to reduce your stress. Did you know all those symptoms I just described are symptoms of stress? And we're going to do this by regulating your nervous system. I'm going to explain what your nervous system is in a second. But many women in public health, and myself included 7 years, 10 years ago before I started this work, don't really know that what's happening when we're stressed is our nervous system is freaking out. And there's some simple things we can do to reduce that anxiety, reduce that feeling of tension, feel calm again and grounded, and ultimately reduce our stress. And if that's what you want to experience, this video is for you. My name's Marissa McCool. I'm the public health burnout coach. I'm here to help you lose the stress and reclaim your life. If you're new here, welcome. I'm so happy to have you. And if you're a subscriber, if you've watched videos before, welcome back. I'm so glad you're here. I'm so glad you clicked on this video. This has been one I've been looking forward to for a while. And I will tell you, I'm all cozy because as I'm filming this, it's 3 degrees outside where I live in Colorado. So cozy up, get some water, get a cup of tea as we talk through how to reduce your stress. Now in public health, stress isn't just, I have a lot to do and not enough time. It is a lot of the times, but it's also feeling emotionally exhausted, working on topics we really care about that are impacting the communities we're serving and feeling like we're not getting anywhere. Feeling defeated by policy changes that are happening and feeling hopeless about what's going on in the world and in our field. It can be the constant shifting priorities that make us feel uncertain about the future of public health and our career. And maybe you talk to your spouse about it or your friends, but they don't work in public health, so they don't really get it. They don't understand how taxing it can truly be. Well, I understand. And everyone else here in this channel community also understands because we're in it with you. We're in public health because we care, because we're passionate, because we want to make the world a better place. And we also know how hard it can be to work in this field, how exhausting and taxing it can be. So you're not alone, but also you don't have to stay stuck there. There are some tools and strategies that work to help you feel more calm and more balanced and more focused, even amidst all of those external challenges we're navigating every single day. First, we need to talk about what stress is. This is really important. In our society, we often talk about stress every single day. I'm stressed. This is stressing me out. And we're talking about it as if it's an emotion we're feeling, when really the emotion we're feeling might be overwhelm, might be frustration, might be annoyance. Because stress itself is not an emotion, although we use that word that way. Stress is a physiological response our body has. Now stay with me. We're not going to go too deep into the science here. But when our brain believes there is a threat, and it can be a real threat or a perceived threat, it triggers our fight, flight, or freeze response, which is the stress response. And that's when our nervous system gets triggered. Because if there was a real physical life or death threat, danger, our body wants to kick into gear, our brain wants to kick into gear and protect ourselves. Running from the danger, fighting off the danger, freezing and playing dead so the danger doesn't harm us. And that's our nervous system is responding in ways that allow us to have that response and keep ourselves safe. Now, what happens in modern world is we're having that stress response, number one, without even really realizing it. But number two, over triggers, over external events and incidences that aren't immediate life or death danger to us. It can be over an email or looking at our to-do list or reading the news. We can have that same response. Our brain thinks there's a threat. It triggers our fight, flight, or freeze. Our nervous system gets activated and we start having a fast beating heart. Our stomach drops, our hands sweat. It feels like we're having anxiety, or we shut down. And we kind of freeze and we feel apathetic or we feel numb or we get reactive and we yell and we throw things or we storm away. First of all, if you are having that experience navigating the world today, nothing's wrong with you. It's just your nervous system and we can regulate it and we can slow it down. We don't want to get rid of the nervous system. We don't want to get rid of the stress response. We don't want to get rid of fight, flight, or freeze. We need that. Those are important functions of our physiology, especially to stay alive. But what we want to do is to not have those be triggered or feel out of control when we don't need that response, when there's nothing life or death happening right in front of us to us. So when you're at work, when you're working from home, when you're in any situation where you're starting to feel those sensations, those symptoms, those experiences of stress, fight, flight, and freeze in your nervous system response, hand sweating, heart beating really fast, stomach drops, trouble focusing, brain thinking a lot, right? You're struggling to respond, all those things where you feel a little bit out of control in your body. Here are some tips that you can try to help you. The first one, which I actually use all the time and was recommended to me by my therapist for a specific situation I was navigating, is touching cold water. This is a pattern interrupter. So for me, I'd have a glass of ice cold water, and it was a glass where when I held my hands around it, I could actually feel the temperature. Some people, it's splashing really cold water in your face. This can disrupt that nervous system activation and slow it down. Tip number 2, breathing. I know we hear this a lot. We hear it from meditation teachers, yoga teachers, and sometimes it can feel like breathing's not going to solve these problems. Well, no, breathing is not going to solve policy changes and not going to solve, funding cuts, but it is going to help you regulate your stress response and slow your nervous system. It is one of the most effective tools because when we are focused on breathing, we have to be present in the present moment. And it slows us down enough to see that in this moment, we are actually physically safe. So one very easy strategy is to breathe in through your nose and breathe out through your mouth. Breathe in for 4 seconds, breathe out for 6. The key here is to breathe out longer than you're breathing in and repeat that 4 to 5 times. This will tell your nervous system, your brain, hey, we're safe. We can slow down this response. You can do this in a meeting. You can do this at your desk. You can do this in the bathroom. No one has to know. You don't have to do it really loud. You can just do it quietly and count in your head. It's a great, great strategy. Tip number 3. Bilateral stimulation. Now, I'll tell you, I have used this in really intense therapy sessions when I'm with my therapist, and it works great. I have used it in meetings or in work, and it's not quite as effective for me in that context. But I have colleagues, I have clients where this is really effective in those day-to-day situations. So again, all these tips are try them out, see what works for you, what works in the context of when you're experiencing stress. If you've never heard of bilateral stimulation, it's basically a rhythmic right to left to right motion to help your brain settle. One option you can use is a butterfly tap where you put your arms across and you just tap one hand and another, one hand and another, and you breathe and you focus and you breathe and you focus. You can do the same thing with your feet, tapping your feet right and left and right and left. I have a really good colleague, a somatic coach, who actually has coached me many, many times. And one of the things she does is using something in her hands to go across her body. So can look like even getting like a pen, a Sharpie, anything, and going across your body and moving it across. Now, this might not be as feasible in a meeting, but on a break, maybe. So try those out and see if any of those are effective for you. Tip number 4, grounding. If you've been in therapy before, if you follow therapy TikTok, you probably heard of this strategy. This is where you name 5 colors or 5 objects, and it really helps you, again, come back to the present moment and signal to your brain, we are safe in this moment. What we're trying to do is get our brain out of thinking there's a threat, because that's what's triggering all this response, and see, hey, we're safe, we can slow down now. This is an activity you can really do anywhere. So you name 5 things you see, name 4 things you feel, name 3 things you hear, name 2 things you smell, name 1 thing you taste. I'm going to say that again if you want to write it down. Name 5 things you see, like I see a lamp, I see my water bottle, I see my heater, so on and so forth. Name 4 things you feel. I feel my sweater. I feel the chair under me. Name 3 things you hear. I hear cars. I hear silence. I hear the wind. Things like that. Name 2 things you smell. I smell my candle. I smell my husband cooking. Name 1 thing you taste. I taste water because I just had a sip of water. Things like that. You can keep it simple. You can also do the color version. Name 5 things that you see that are red. I see a book. I see a pen. I see a gift card. You can do it with colors too. So here's what I want to remind you of. Getting out of stress isn't always about thinking your way out of stress. Now, I am a cognitive coach. That's kind of one of my main philosophies with my coaching approach, is a lot of cognitive work. But I match that with the somatic work. Somatic just really means in your body. I match it within our body because emotions exist in our body and the stress response exists in our body, triggered by what we're thinking. So it's really about both. And today's video is really about the body-based work. How do we slow our body's reaction? There are other videos where we'll talk about thinking. How do we change our approach to thinking to reduce our stress? They both can work, but in different contexts at different times. They can work individually, they can work as a pair. And I recommend the strategies in this video for when you're feeling those intense physical sensations. Your heart's racing fast, your stomach drops, your hands are sweaty, where you're feeling tuned out, numb, or you're feeling reactive. These can be really great because it brings your body response down, so then we can think a bit more logically. As a result, once we've done that, we can make better decisions, we can ask better questions, we can interpret information, we can think critically, we can problem solve. The external challenges of your workday might not have changed, but your response to them and your experience of them can. So I encourage you to try any of these tips out when you're starting to feel that physical sensation of stress and see how they help you. If you're a woman working in public health and you want more support, more guidance on how to feel less stressed and feel more focused and present and in control of your work, then I want you to stick around. Click that subscribe button. I'd love to have you as a part of this community. I put out videos every week to help you do great work in the world without sacrificing yourself, your health, or your happiness. And I'd love to learn from you. Have you heard of nervous system regulation? Have you heard of somatic tools? Tell me in the chat. I would love to share more resources, make more videos to help you with that. It's so effective, but tell me where you're at. Have you heard of it? Are you familiar with it? Do you need some basics? Are you an expert? Do you want some additional tools? Let me know in the comments, and I'd love to help you and create more resources for you. With that, I'll see you next video. Bye, everyone.